We don't want to shove everybody in the same box where it's like, hey, if you have breast implant illness, this is the protocol that you need. And this is one of the pitfalls that I can't stand on social media with influencers or even functional medicine practitioners or people who are just like, just take this supplement, this is all you need. Anybody that says that is lying to you, because each one of us is completely different. All right, everybody, welcome to another episode of the Jacque Show. Today, we're going to work to elaborate a little bit more on breast implant illness. And so when I did the topic, I didn't know how well it was going to be received. I didn't know that, people didn't know about the symptoms, the signs. And one of the big things that people don't know is how to then detox once they are removed. So if you haven't listened yet to the Breast Implant Illness podcast I did a few episodes back, go back and listen to that one and then come back and meet me back here. And then we'll basically talk to you about, hey, we got them out now. What can we do to be healthy, right? So when you go through this surgery, there's different risks associated with it. They can use anesthesia. They can use antibiotics. They can use a lot of medicine in this to try to help you through the process. And some of it is unavoidable. Some of it is inevitable. Some surgeons won't do the surgery unless you sign up for their treatment approach, which is typically going to be medications, antibiotics, sometimes IV antibiotics. Basically, you're going to be starting from scratch, especially when it comes down to the gut. And so if you are thinking about getting your implants removed, it's best to prep your body prior to going into this process, right? Because if we have really good, really healthy, really vibrant probiotics, we don't have leaky gut, our diet is on point, we're not inflamed except for what the implants are doing, then your recovery time is going to be incredibly fast. And one of the things that people need to know in this is that we need to have proper collagen. So we can supplement in with different collagen supports, whole body collagens. There's different types of it, but you're going to want to get any type of collagen really in there. So that way you're working on rebuilding the cartilaginous tissue come post-surgery. Another really easy way to do this too, it's also great for this time of year, is boost up your vitamin C. Now vitamin C, it's one of those things, there's a product I use called Stellar C. It's in a pill form. I usually do 2 pills 3 times a day, but you can go to bowel tolerance with vitamin C. And that means you take as much as you can until it loosens your stool. And then that's like your cap for vitamin C. Now vitamin C is a vital nutrient that's going to be a vital vitamin that's going to be used to replenish and repair and cause a rebuilding of collagen. It's a building block of collagen, okay? So that's just kind of like a starting point. Prep the body prior to surgery. You get the surgery done. What do we do now? Now, there are things we can do post-surgery. Sometimes it could take a little bit of time. It's not like you're going to be moving too quick after surgery because we have to make sure any type of sutures, or if they did any incisions, we have to make sure we don't get infections. And so post-surgery, one of the things that I highly recommend, this is actually from one of the docs I used to work with, his name was Dr. Zeno, and he told me about Manuka honey. And you can actually place Manuka honey on any scars that were produced, whether it was from your breast implants originally being put in, sometimes it can work, or whenever they do incisions for the removal, or if they do full cut for the removal, then you can go in and put the Manuka honey around those areas. It has natural antibiotic properties, it has enzymatic properties, and it typically reduces any scarring, any visible scarring post-surgery. So it's kind of a nice little thing to have in there. Obviously, it's going to be super sticky because it's honey, but it does do the trick. Okay, another thing you can do too to help with infections is food-grade peroxide. You can use like a 12% or so. You can find it on Amazon. There's one called like the bubonic plague hydrogen peroxide, but it's food grade, and that's something that you put on there as well to make sure there's no infections. Now, it burns like crazy when you do it, but it cleans it, okay? Now, what do we have? We have inflammation. We had a bomb that was basically dropped on your body and then taken out of the body. Now we have to clean up the aftermath. It's like a bomb was dropped on the city. We have to assess. You have to assess the damage. How bad was it, right? Did you have mold on the breast tissue? Did you have bacterial overgrowth on the tissues? What happened during the surgery that we need to clean up now that you're done? So we assess. How do we assess? We want to take a look at your hormones. Okay, so see what the hormones are doing right now. Okay, we want to take a look at your gut. What did the antibiotics do to you? right? Did you pick up any of the infections in the hospital? C. difficile, right? One of the most commonly transmitted infections in hospital settings. Did you pick up any other bacterial overgrowth? Did you develop candida or fungal overgrowth due to either the mold from the implants or from the massive amount of antibiotics that they put you on that candida was then able to overgrow, right? Our body just couldn't defend itself. The other thing we want to do is a mycotox panel, right? Because we want to see, hey, do you have toxins that are being stored in your body? If so, run a panel on that. And those are some of the most common ones that I do on my patients post-explant. Okay, there's other ones. You could do an organic acids panel or an oats test to figure out how the organ systems are all kind of functioning. But our goal in this is we want to make sure we approach the neuroendocrine, the GI, and the detoxification pathways. And we want to make sure that they're super up to par, okay, super up to snuff. So we do testing. While we wait for the testing, what do? If you haven't already started an anti-inflammatory diet, then do it. Okay, even the anti-candida diet can be very beneficial because more often than not, if we have these things in there, you're going to have some fungal overgrowth. So starving your body of carbs is going to be good for the short time for a treatment process, for a therapeutic process, while we starve out the infection and we slowly increase the amount of carbohydrates that you have back in. Okay, make sure you're anti-inflammatory. So an anti-candida diet is great. Paleo-autoimmune is also a great diet for you to be on. Okay, those two are probably the most anti-inflammatory diets that you can be on. All right, make sure you're getting plenty of protein as well. Okay, protein is going to be huge because we're going to need those amino acids to rebuild and repair the body. Lack of protein, not getting enough meat, not getting enough good quality stuff in there, then our bodies are going to struggle. Recovery time is going to take a long time. Okay, so make sure we're getting enough protein. The other thing is make sure our bodies are getting enough sleep. Make sure we're anabolic at night. If we're not sleeping well, make sure that we're doing something to get us to sleep, whether it's a breath work technique or you're taking something like insomnitol to try to help. It has melatonin in it and some of the precursors that our body uses, the building blocks our body uses to create melatonin so it doesn't shut down your natural response. Now there's varying, debates on melatonin is an addicting. Melatonin doesn't shut down your natural production. But I can tell you if you go on melatonin for 3 weeks, 4 weeks or so, you're going to have some sort of withdrawal symptom from it, which means you did grow dependent on it. So making sure that you have the building blocks for melatonin first is going to be crucial at helping you fall asleep. Okay. Now from there, with the anti-inflammatory diet, there's other things that you can take to bind any toxins that were released from that explant. So we take something called biotoxin binder. This is a product from Cellcore that we use all the time. If you need any of these things that we have just mentioned so far, you can definitely give us a call and we can ship some out to you. You don't have to be an active patient for it, but when it comes to the testing, it's strongly recommended because when you see the results, you're probably going to be confused as to what you're seeing. And I want this to be a smooth and easy process. And I also want to strike while the iron's hot. I want to get these toxins out as quickly as possible so you can feel the change. Okay. Other thing we're going to do, all right, we test the gut, we test the mycotoxins, test the adrenals, test the hormones. What else can you do that's just kind of a passive, kind of thing, a little zen bath for you? It's basically that, right? So the bath, what we're going to do is an Epsom salt bath. Okay, you can put a cup of Epsom salts in. You can do a little bit more if you want to, but the primary thing that I want you to be aware of is we don't want to use any type of fragrances in our bath, in our Epsom salt. Okay? Now, fragrances, even essential oils, can still be inflammatory to the skin, especially if not put in a carrier. I know some people are like, well, I add eucalyptus, I add peppermint because it helps with the breathing. I personally don't recommend that because it tends to be too strong. I'm very sensitive to fragrances on my skin, so it shouldn't be on the majority of people's skin, in my honest opinion. So just do a simple bath. If you need the smells, light a peppermint candle. If you have a peppermint candle, make sure it's not toxic. But light a candle or something like that to give you the ambiance that you want in your bath, okay? So an Epsom salt bath, you want to bring the temperatures up as high as you can kind of tolerate, get a little bit of a sweat in there, but not to the point where you're miserable, like you're sitting in, 140 degree Arizona day. Make it so it's like, I'm sweating, but this actually feels good. I'm getting these toxins out of my body, I feel all right. And then you stand up afterwards, wash your body off, okay, to get some actual soap, scrub your body off, get yourself nice and clean, any toxins off there. And you can even take that biotoxin binder before you actually go into that bath. So any other toxins that cross out of the cells and go into the body, that biotoxin binder will bind them up for you. Again, it makes it a little bit easier for you. Now, a step past that is if you have access to direct heat, so Arizona sun, or if you have an infrared sauna, or you have just a regular or a steam sauna, using those things, trying to sweat this stuff out. We want to try to do that once a day if you can. If it becomes too much for your body, listen to your body. This isn't a matter of being forceful and forcing your body to stay in for a designated amount of time. If you're in one day in 5 minutes and you're just like, oh my God, I cannot, then get out. Don't force it, right? Even if the day prior you were in for 30 minutes somehow and you're like, oh, 5 minutes is hard for me today, listen to your body, okay? You can only detox as much as you can handle. Otherwise, it leads to a whole host of side effects and symptoms that come along with the detoxification process and aren't exactly enjoyable, okay? So listen to your body. Next thing you're going to want to do is dry brush. So dry brushing. So basically you're taking a brush and you're scraping it on your skin. Don't wet it. Obviously it's a dry brush. Scrape it on the skin there. Get some things to go up towards the heart, around the body. And a lot of the dry brushing tutorials you can find on YouTube and things. But it just helps with the circulation to kind of get things flowing around for you. Okay. Another thing that helps with circulation and lymph flow is going to be either a vibration platform. Okay, I know Lifetime Fitness, I think, has vibration platforms. I saw a guy exercising on it the other day. I was like, oh, that's pretty cool. Vibration platforms can be very beneficial. Trampolines can be very beneficial. And even the small ones, they call them rebounders, are also super impactful with getting your body to kind of function and get that lymph going. Okay? What else? This is going to be more of a macro style cleanse. Now, when we talk about a macro style cleanse, what does that mean? It means we're moving a ton of crap out of your body at the same time. And it's quite literally at this point. What I would recommend people to do after they're done getting the explant is let's clean that liver and gallbladder out as quickly as humanly possible. If you had any type of mycotoxins love fat, so they like to hide in fat. Gallbladder is the one responsible for fat emulsification in the body. So a lot of people with toxicity is going to have inflamed gallbladders. If they still have them, they're going to have referral pain to the shoulders. These are like doorbell signs for gallbladder. So there's a guy named Andreas Moritz. His cleanse has been around for probably a century at this point. Been around for a really long time. And he designed this because he knew that the liver and the gallbladder are so intimately connected with health in the body. It's great for pregnancies. I mean, it's safe enough for pregnant. It's great for pregnancies too. Fine for breastfeeding, like the sensitive times. Like anybody could basically do this stuff. Even if you don't have a gallbladder, you can do this flush. Is pretty awesome because you may even still have some gallstones that are stored somewhere, whether it's in the liver or in that common bile duct. So basically what you do is you eat super clean, all right, really anti-inflammatory diet for about 6 days or so, 7 days total. And you're doing coffee enemas once a day, once every other day if you can. You're drinking either 32 ounces of apple juice, okay, but if you have blood sugar issues or if you're diabetic, then you can use malic acid, and you would use a teaspoon, I believe it is, and 1 32-ounce thing of malic acid, so you dilute it. Otherwise, it's super, super, super sweet. Very sweet, okay? What that's going to do is help to soften up any type of liver, gallbladder stones that you might have, so that way when you do the flush on day 6 into day 7, you're excreting the stones out of the body, getting through the common bile duct, out through the colon, and out of the body. Now, I am giving you a skeletal outline of how to do this process. If this is something that you're serious about and you're like, hey, I'm getting this done, I don't know what the heck you're talking about, find me, DM me, email me, find me any way you can and say, hey, I listened to that podcast about detox and breast implant illness, and I would really like to do that. And I have a whole like template that I send for any of my patients to do. Super cheap, super effective to do it. Just make sure that you don't have anything scheduled the morning or the day of that flush, because you are going to be on the toilet for that. Okay. You also have to be super intimate with yourself because you're going to be doing coffee enemas throughout the week. Men, suck it up. You know, obviously you're not doing, you're not going to get breast implant illness unless you went that way, I guess. But when it comes to men doing this, men can do this as well. This is a great flush for really anybody. Okay. And the guy who created this said, we should do one when springtime, fall time, we should do this for our body. And if we do have stones pop up, then we do it every single month until we don't have any stones show in the stool or in your toilet. All right, and green ones are going to be from gallbladder. Little sunflower seed looking ones or like poppy seed looking ones are going to be from the liver. So when you have all this knowledge and you're like, okay, what do? You start simple, right? Start with the anti-inflammatory diet. Work on binding some of these toxins out of the body, right? Get tested see what the damage truly is, because your body will change with those taken out, right? Like if you're walking around with a cactus thorn in your foot all day, every day, and you're like, ow, ow, ow. Then as soon as you pull that cactus thorn out, I was like, oh, cool. I'm no longer in pain. My blood pressure went down. My cholesterol went down. My heart rate went down. Everything went down. What the heck? Well, you got rid of the threat. You got rid of the response, right? And so we don't want to shove everybody in the same box where it's like, hey, if you have breast implant illness, this is the protocol that you need. And this is one of the pitfalls that I can't stand on social media with influencers or even functional medicine practitioners or people who are just like, just take this supplement. This is all you need. Anybody that says that is lying to you, because each one of us is completely different, right? Even identical twins are not identical. Genetically speaking, they are not identical except at birth. They're changed through epigenetics in our body. So some people may have had a worse case of breast implant illness. Some people, maybe they just got them up because they didn't want to develop breast implant illness. Maybe someone's hormones, or someone is dealing with infertility, or someone's dealing with irritable bowel, or somebody's dealing with a gallbladder issue, right? The things that I'm guiding you in on this is like, hey, anybody can safely do this, but this is surface level stuff. Okay, if you are choosing to get these out, further testing is going to be required to make sure not only do you properly detox this stuff out, but you make sure that you don't have any hidden inflammation or any hidden disease that's brewing up underneath the surface, right? Because inflammation is going to damage the adrenals. You can have chronic fatigue, your adrenals can be shot, right? Your progesterone can be tanked due to the mycotoxins. Or if you have, again, irritable bowel, you can have gallbladder that's about to just burst. You're like, I don't know, I think I should get this out. These are all different, unique experiences, and no two people are the same going through this. So my honest opinion, my honest thing where I'm like, hey, how do we detox this, right? We can do those things, right? Or we can do even with, if you wanted to do more like a full inline detoxification, right? You could take herbs that are going to support phase 1, phase 2, and phase 3 of liver and colon detoxification, right? This is where things get a little bit more intricate, right? Where I could give milk thistle, but if you're dealing with anemia, if you're dealing with other issues, I can't give you milk thistle. Shishandra is a great one for that. What if I gave you a amino detox or detox antiox, 2 products from Designs for Health? It's the phase 1, phase 2 support. And one of them has a phase 3 support in there too, which is calcium D-glucarate, to make sure any estrogens that you do have are getting pushed out of the body. What if there's an instance where you have MTHFR and you can't methylate properly? So you have all these excess hormones, but you can't get rid of them. Testing is going to show that. Testing is going to show that you can't methylate. And if we can't get it to go, or if you're like, hey, I know that I have MTHFR, then there's things that we can give you for that. I wanted to start this off being as easy, as smooth as possible. Like, oh, I could do that, I could do that, I could do that. And then I wanted to overwhelm you. That's truly what I wanted to do. Why? Because I need everyone who's listening to be aware of this. Whether you want to choose to believe it or not, those breast implants are not supposed to be in your body. It doesn't matter if it's a saline, it doesn't matter if it's a silicone or any of that. It doesn't matter. Any foreign thing in the body is going to be subjected to our body's natural intelligence, right? Our innate intelligence. And it's like, whoa, that's not normal. That's going to make my body have to compensate in ways that it wasn't designed to, right? When you have a sac in there, it's not typical breast tissue, right? It's not. So it can't send signals there. It can get infected, and then there's different lymph channels and things that can be impacted, right? Your axillary lymph nodes can be inflamed. You can develop breast cancer with breast implants. So we need to make sure that we're responsibly detoxing from this stuff. And so even if you don't work with me, work with somebody who's going to properly test you after you get these implants out, because pre-you and post-you is not going to be the same. Okay, so again, it's vitally important to recognize that and to acknowledge that so that you don't get treated the same way as Karen down the street. Okay, and this is more than likely why a lot of these docs don't give you follow-up detox procedures, because they don't really, well, one, they don't really understand. A lot of them don't understand it anyways, but they don't understand the detoxification processes to begin with. So trust somebody like myself or somebody else who's a functional medicine practitioner, naturopathic health expert, somebody that I've trained. Talk to somebody like that to help you to do the proper step down from breast implant illness. So again, I wanted to keep this as short and sweet as I possibly could, just so that it's consumable. Some of my videos go like an hour long or so, and I know that could be pretty difficult for people to sit there and listen to me ramble on for an hour long, right? So use these, okay? Take notes. If you were like, oh man, I need to go back and listen to this, take notes, great. Right? You can listen to it again. You can listen to it in 1.5 speed if you can handle that. But take notes down, take notes on the process. But if you have any questions at all, especially on this topic, please don't hesitate to reach out. Find me on Instagram, DM me. Either me or my team will respond for you. You can email me as well. And I'm happy to do a free 15-minute call with you too, just to kind of say like, hey, what are we going through? How can I best serve you? Because I'm here for you. I'm here for every single one of you who are on this, who are suffering with this right now. Breast implant illness was something that I don't think was even conceivable in the mind when we first had implants being put into the body. We had no idea what these things were going to do. There was just a cosmetic thing, and like, oh, let's go do it, right? And now we're dealing with not just cosmetic for women who want to enhance themselves, but we have implants being put in post double mastectomy, which there's a ton of damage that's going to be done, and you'll see this in the future. I guarantee it, with how post double mastectomy implants are going to respond based off of that person's environment, because it's heavily inflamed, already cancerous, right? And then you're going to do chemo, you're going to do radiation, you're going to do all those other treatments for breast cancer, right? But never truly zapping the underlying cause. And so that's going to cause deterioration of those implants much faster. Okay. And there's a high rate of breast cancer due to breast implants. Now there's some research that I did on the other podcast. Some research is like, there it is, it's right there. And there's other docs like, shut up. Don't tell people that, because what doctors are getting, they're getting paid double, right? You get the implants in and it maybe costs $5,000, $6,000, $7,000, and to get them out, that's like $14,000. So you're paying the same guy like 20 grand to put them in and put them out, right? So let's educate ourselves. Let's be smart. Let's be responsible with our bodies. So anybody who's suffering with this, or if you're a guy and you're listening, like, man, my wife has been having all these crazy symptoms ever since she had her breast implants. And guys, this can happen a month after you had them. This can happen a day after you had these things in there. It depends on your immune system. It depends on how your body receives these implants. And I hate to say this, it doesn't matter if you have a positive, like, I want them because I feel like this is a part that I'm missing. It doesn't matter your outlook on them, whether you love them or whether you're doing just for vanity and you're like, I just want to have bigger breasts. It doesn't matter. Your body doesn't care what your input is before you get them in. There's still toxic bags that are in your body. Okay? So if you're dealing with the horrible symptoms, go back and listen to my previous podcast on symptoms. Try to do these detoxes. All of this is safe too. You can do all of these things even if you have implants in. It's just a matter of how long do you want to do this for, right? The duration and the entirety of you having implants is going to be a long time. And if you haven't had them check in 10 years, which I think is like the normal life cycle of implants, right? Then you're going to be stuck. Then you're going to have these implants that are just going to be inflamed. They're falling apart and causing a lot of harm. All right, so look for the signs and symptoms. Talk to your doctor about this stuff. And if you need help with the detoxing, just reach out. So thank you all for tuning in. Short and sweet today. I love you all. Talk to you next time.